FDA regarding boosters and how they made their decision, what the reasoning was, and where do we go from here?
Yeah, so there's been a lot of back and forth about the issue of booster doses. As you recall, there was an approval for a third dose for persons with severely immunocompromising conditions last month, and that has allowed people who are at severe risk of contracting the disease, despite having two doses, to get further protected. So that's been good. But the discussion now focuses on individuals who have received the vaccine perhaps 6 months, 8 months ago, and whether there needs to be an across the board recommendation for everybody to get a third dose or booster dose of the vaccine. The controversy, if you will, within FDA has been, should there be a selective recommendation for certain groups, or should it be for everyone? The FDA, in reviewing the advisory committee to FDA, and there's an advisory committee to CDC as well. You mentioned that I sit on that, meets tomorrow and also Thursday, and they will come up with formal recommendations based on the the FDA discussion and review and approval. But the bottom line is the FDA Select Committee felt that there was strong evidence that people who are 65 and above will benefit now from a booster dose, and that persons as well with high-risk medical conditions. So we're not talking about people with bone marrow transplants or organ transplants. We're talking about people with diabetes, heart disease, high blood pressure, obesity, those sorts of conditions as well, in addition to more advanced age. Those folks have shown evidence that the antibody protection has been waning over time, and that if you're 6 months or more out, you should be eligible to get a booster dose. That is sort of that's the stage that's been set by FDA. The formal recommendations are made by CDC. Those will be forthcoming in the next couple of days. By Thursday afternoon, we should have those. And if it's approved in that form, the booster doses should be ready to go, perhaps by the end of this week or the first of next week at the very latest. In the whole context of that, we have good news as well, but it's preliminary about whether children ages 5 to 11 will benefit from vaccine, and also about booster doses for the other two products, the Johnson & Johnson, Moderna. I don't want to get ahead of myself by getting into those areas, but the focus right now is on the third dose for the Pfizer recipients, and we anticipate a decision being made literally in the next 48 hours about that.
Good. So there's a lot happening, as you say. So we've got three primary vaccines in the States here, and you mentioned J&J. So the news yesterday talking about the second dose of their vaccine substantially boosting protection against COVID, which is interesting because obviously J&J was just a one-dose vaccine compared to Pfizer and Moderna being two. So any observations or comments on that? And then what's the next steps with that vaccine?
Yeah, so all of these announcements are so far about the J&J and Moderna are company announcements. They have released preliminary data to the media. There's a lot more behind that, tons and tons of data that FDA will pour through to make a decision. It will probably take in the range of a month or 6 weeks to go through all of that and to come up with a formalized decision from FDA, and then going to CDC again about the additional doses for Moderna and J&J. But the preliminary information looks very promising. I mean, it's extremely good, very heartening, and we're not seeing any kind of alarm signals about adverse events so far, and we don't expect to see any additional at this point. But again, more review to come. The timeline is a little bit uncertain, but one can usually expect a month to 6 weeks beyond this point before there'll be FDA action on those issues.
Gotcha. Okay, well, hang with this for a moment if you could. I'll ask Dr. Harledge a question to kind of put this into context for us here in Louisville. So what does all this mean to people who are fully vaccinated? And should they be worried that their initial vaccine immunity is waning, or how do you discuss this with people?
Yeah, so for now, as Dr. McKinney said, we are continuing to focus third doses on folks who we know have a reduction in their immunity. If you take medicines or have a condition that reduces your immune system's ability to function, then you should look into getting a third dose. If you are over 65, which can by itself have an impact on your immune system, you should look into getting a third dose. But the good news is that if you are, someone in middle age or younger who has had their vaccine series, that you can feel pretty good that your immunity is still hanging around, and that your immune response should still be strong if you were exposed to the COVID virus at this point. So we're trying to do this in a orderly, prioritized fashion, and those who are at the highest risk should be the ones getting a booster right now. And there's no need for anyone else to rush out and get one at this point.
Okay. So I know the Vaccine Distribution Task Force is meeting this week. You might want to give a brief reminder to everybody what that is. But one of the things you'll be looking at is, here's an approximate number of people in the community that is eligible for the booster, and then how those shots will be distributed as well. So any thoughts on that would be appreciated.
Sure. So the folks on that initial list of specific immune conditions represent about 2 to 3% of the population, which is roughly 20,000 people in the metro area. And then when we talk about people over the age of 65, that could be as many as 130,000 people here locally. The good news is that that group is very highly vaccinated from the outset. Their vaccination rate is over 87%. So it's not an emergency to run out and get that third dose. It's something that can be done in an orderly fashion. The vaccine task force includes folks from all of our local health systems, including the three major hospitals, our federally qualified health centers, and also some major employers who represent large groups of the population. And we are able to help coordinate through that group to make sure that capacity is there. Right now, there's plenty of capacity for third doses, and appointments are available for that specific set of folks who needs to get one. The task force continues to weigh important possibilities. If a recommendation should come down the pike eventually for the so-called boosters for all, so saying that everyone needs an additional dose, that would be a larger concern, and we want to make sure that we can give those doses in an appropriate fashion without compromising the ability to continue to give first doses to people who have not yet had one, because getting those first doses out to as many people as possible remains the highest priority, and it remains the most important measure we can take in terms of stopping the spread of COVID and limiting this Delta surge.
Okay. Doc, uh, McKinney, you want to add anything to that? I mean, we've got first doses, we've got boosters, we got the global issue of vaccines as well. We're blessed in this country to have more vaccines than we have people that want to take them. I mean, how do you look at all this as a system to get us to, global immunity here?
Yeah, so I think it's very important, as you say, Mayor Fisher, that we don't lose sight of the need to immunize globally, because this virus will continue to mutate in countries where it's circulating. And if we don't eliminate that transmission there, it will certainly find its way to our country at some point. So it's in our best interest, as well as in the interest of those countries, to be immunized as well. But that having been said, there does not seem to be any lack of vaccine doses to go around for third doses at this point. I think it's helpful in the sense that if we have a select recommendation for certain groups to get immunized first for dose 3, that will allow things to proceed in a more orderly fashion. It won't be so chaotic trying to get everybody done all at once. That recommendation across the board for dose 3 will be coming at some point. We don't know exactly when, but you can see from the trends it's going to be needed. before too long. And I think the other thing to remember is that we're entering flu season as well, and there'd be recommendations. There are recommendations already for those groups who have traditionally been considered at high risk, as well as the population across the board, to get immunized against flu. And it is possible to get, both vaccines administered at the same time. CDC has looked at that and said that that is entirely acceptable, and there's no reason to expect there to be a problem with getting both. But people are going to have to look at the possibility of, their booster dose and flu doses both being done sometime this fall for optimal protection. And then, as the pediatric considerations come to the forefront, the age 5 to 11 group, it's important to note that the dosage recommendation from Pfizer is for 1/3 the amount that adults are getting. So we'll be able to extend the supplies by a factor of 3, really, to the kids, because they won't require as much. So that'll be helpful, I think, in looking at the supply that'll be needed to eventually cover the younger school-age kids as well.
Mhm. And Dr. Harledge, what are we seeing relative to kids and infections right now? And how do you see all that playing out now with the Pfizer announcement?
So across the board, we see a continued increase in cases for folks under 40. So the 20 to 40 set, and then the 0 to 19 set. So part of that is because there are kids in school and they're passing things around, just like they pass germs every year. This year, COVID just happens to be one of them. But the other thing is that that group is not yet eligible for vaccination by and large. So as Dr. McKinney said, there is going to be a child-sized dose for child-sized patients. The 12 and up set is going to continue to get the adult-sized dose because they are generally adult-sized. Only Pfizer has made the application for a third dose at this point, and only Pfizer has made the application for the 5 to 11 set. So in the sense, we continue to recommend against mixing products. So only people who have had Pfizer are even in consideration for a third dose, and only Pfizer is in consideration for children. We had this week, we have had, I believe, 13 pediatric hospitalizations. And it is true that generally children are not as severely impacted, but we have enough cases in children that we do see some severe impacts in some kids. And, from the perspective of a public health officer and also as a mother, I would say that one is too many. So we want to do what we can to protect our kids. And so far, we've tried to do that by sort of cocooning them and surrounding them by people that have been vaccinated. And I'm excited that here in the next couple months, we should hopefully have the ability to extend vaccination to those kids as well.
Okay. So is that what you say, Dr. McKinney? We're still looking at a couple months before the 5 to 11-year-olds will be vaccinated?
Well, the discussion is ongoing about that, but I've heard several, and they could be slightly optimistic predictions, but several experts in the field, including the former FDA commissioner, who said that we could have those available by Halloween, by the end of October. Those could be available. So possibly between 4 and 6 weeks for those. We're hopeful that's the case, because obviously there are many parents who would like to get their kids covered as quickly as possible.
Good. Okay, Dr. Harledge, do you have anything else to comment on before we jump to the media questions?
I think that's appropriate. The timeline, I think, maybe by Halloween, certainly by the end of the year. I'm personally looking forward to seeing the full set of data and reviewing it, but I anticipate getting my child vaccinated as soon as it's available. And I know there are a lot of other folks out there anxiously awaiting that change as well.
Okay, very good. Okay, Kathy, with that, let's go to the media questions.
Okay, I'm going to start. There are a couple of questions that are not COVID related, Mayor. So we're going to start with those that are COVID related. The first one is from Lexi Radaman. In relation to COVID, does the city have plans for some sort of vax blitz for the newest age group allowed to get the vaccine? Dr. Hartledge, would you like to respond?
Sure. So, Lexi, the numbers right now do not necessitate a blitz, so to speak. We're hoping for sort of an orderly stream of people coming into the existing vaccine sites to receive a third dose if they are in the group that needs those. If there is a change and we ultimately wind up with boosters for all, and needing to vaccinate everyone sort of all at once, that would be a different story. But for right now, it's only 65 and up or immunocompromised who received Pfizer for their initial series. So there are plenty of appointments available now for those people, but we do continue to have conversations around planning in case we should need to have a large scale effort to accommodate third doses for folks. As I mentioned, we want to be able to do that without compromising the ability to continue to deliver first doses, because those first doses are really the most important thing we can be doing right now.
Great, thank you. Lexi has a follow-up for you, Dr. Hartledge. Is it likely that the most recent increase in cases is attributed to Labor Day weekend festivities?
I don't know if we have any specific events that we've tied things to from Labor Day, but we do continue to see the highest number of cases being from people going to events, whether that's a music show or a family birthday party or any other kind of events. We even have some outdoor transmission. So it's certainly feasible that there could have been some Labor Day weekend festivities that are tied to it, but I'm not aware of any specific events that would be the culprit.
And Doc, you might want to say this high plateau started when, like mid-August or so, early August, so before Labor Day, and it's continued
Yeah,
since then.
our case counts have been kind of bouncing between, I would say, 55. Our incidence rate's been bouncing between about 55 and 75 up and down for the last several weeks. So it's some kind of a plateau without a major swing in either direction.
Yeah, we closed August 31st, it was 71.43.
Okay, thank you. This next question is from Deb Yetter. Mayor Fischer, has Metro Louisville been tracking the number of workers out with COVID? And if so, which departments are hardest hit?
Yeah, Debbie, we certainly have, and we can get the specific information to you, but the four departments that are the lowest vaccinated right now are Corrections Department, Solid Waste, EMS, and the Police Department. So we have vaccination rates in our departments on the low side, and those groups are 40 to 50%, and then we have several at 100% and a couple in the high 90s. So, but we can get that specific information to you.
Okay, another question from Deb Yetter for Dr. Hartledge. What difference could it make in vaccination rates for the metro area if Pfizer is approved for 5 to 11-year-olds?
So, two things. First, when we talk about vaccination rates, we often consider vaccination rates for eligible individuals, which would make our number higher. Actually, we're seeing about 60 to 63% right now for the entire population versus it's actually closer to 70% for the 18 and up group. But if we're including everyone above age 5 in the denominator to that equation, it may initially make our vaccination rates look a little bit lower, but ultimately I think it will increase our vaccination rates by getting all those eligible kids into the data and getting them all vaccinated. So I suspect we'll see a little dip first and then a rise, and then it will tail off as we've seen basically with every group. There'll be an initial push and then a slow tail on the back end. Would be consistent with what we saw even going back to the 70 and up group back in January.
Okay, thank you. Dr. Hartledge, this question is for you as well from Jasmine Deemers. Can you explain more about the impact of the Delta variant on children and pediatric hospitalizations? What should the community know about these cases?
So, as I said, we have 13 children currently hospitalized, specifically with COVID. We also have a high number of children that are hospitalized with other things, right? Like RSV, the respiratory syncytial virus, has had a sort of unusual timing to its peak this year, but there are a number of kids hospitalized with that. We're coming into flu season now, and we'll have to deal with flu hospitalizations. So just like we talk with the adult population about if all the hospital beds are filled up with COVID or with something else, that there's just not as much space to do elective procedures or to do procedures or to take care of other illnesses. So, you know, if your child needs an appendectomy because of a sudden illness, you want that capacity in the healthcare system to be there for them. So right now we have 13 kids hospitalized for COVID, and we hope that being able to get vaccinations into the younger group over the coming months will help reduce that. In general, children are not as severely affected from COVID. They are the largest group of infections at this point. Many of those may be totally asymptomatic, but you don't want to be the one who has the severe infection or that turns into the long haul COVID with long-term symptoms. And we do still have cases of the MISC, the sort of post-COVID inflammatory syndrome, where many organ systems can be impacted, and the recovery from that can be quite prolonged as well.
Thank you. And then Lexi Ratterman has a follow-up question for you, Dr. Hartledge. Can you clarify, has Louisville started administering booster doses?
Many of the providers locally are providing booster doses. All three of our hospital systems, our chain pharmacies like Walgreens and CVS and others are giving third doses to those who qualify. The LUVAX program is continuing to focus primarily on getting first doses out to underserved populations and those who are at high risk. So we are still spending most of our time and energy on getting those first doses out, but there are many places in the community where one can get a booster dose at this point if necessary, if they need it.
Okay, thank you. This question is from Rachel Droz. Mayor Fischer, today J&J said their vaccine is more effective after a booster dose. A lot of hard to reach individuals, such as our unhoused population, got that vaccine since it was a one and done shot. Are there plans in place to make sure the unhoused population gets booster doses if the feds recommend J&J boosters?
If we don't have those plans in place, we will have them in place. Dr. Hartledge, you might be able to comment on that as well. But this is, you know, part of the ongoing protocols that we have is to identify the people that we'll work with and give them the latest in health updates, if you will, which a booster would be. So, Dr. Hartledge, I don't know if you want to comment on that.
Yeah, so I think we're still quite a ways away from a potential recommendation for repeat dosing with the Janssen vaccine, but you are correct that one of the major advantages to that particular product was being able to be one and done. So for populations that are hard to track down a second time and get a second dose, that's a major issue. We continue to work very closely, especially with the shelters. So I know we've recently been to Wayside and to others to do both vaccination and testing. If a recommendation for a second dose comes out, that's probably where we will start, is with the shelters, recognizing that some of our unhoused population does not utilize that resource. And in those cases, we do have outreach and other events that we've done before that we could certainly replicate to try and reach into those hard to reach pockets and get doses out to those who are willing and able to be vaccinated in that setting.
Okay, this question is from Paul Miles. Mayor Fischer, Dr. Hartledge, will the city or health department make a recommendation on whether kids should participate in Halloween activities this year? Will the recommendation be based on the availability of the vaccine for kids?
Dr. Hartledge, I'll throw that to you.
Sure. So I think similar to the way we made recommendations last year, that we would recommend If you're trick or treating outdoors, that's a relatively safe, not totally safe. There's no 100% guarantees for anything, but wearing a mask, wearing face covering, and outdoor activities are relatively safe. Probably want to avoid the indoor parties and large groups of people, things like that. But the recommendations probably will not be probably will not be vaccine dependent, if only because I think Halloween is probably the earliest that we could potentially see a vaccine recommendation for younger kids, and we are not likely to have a large number of children vaccinated by that date.
Okay, thank you. And then Deb Yetter had a point of clarification, which I think you may have answered, Mayor Fisher, about departments that have employees out ill with COVID and which ones, but we will follow up with her afterwards.
Okay.
That's
The only one I know off the top of my head there is corrections at 6% of their workforce was out. But Debbie, we can get that to you by department. So, Dr. McKinney, any observations or comments from you here on any of the questions?
Not specifically. I do think that Dr. Hartledge is right on target with respect to the Halloween issue. I mean, we don't expect approval for the vaccines to come before that time, so it's unlikely that recommendations for Halloween activity would be dependent on immunization. Keep. I guess that we need to make sure that we stay in touch with the health department recommendations locally based on what's going on in the community at that time. Hard to project between now and then, exactly how the situation will look, but the recommendations will depend upon transmission rates and vulnerability and what is going on specifically at that time. So hard to say for anyone at this stage what the recommendations will be for that activity at this time.
I do want to give a plug to our vaccine distribution task force. They've been leading us through this throughout the whole pandemic, and it's a group of our leading physicians, provider groups, hospital systems, scientists in the city that meet on a regular basis, talk about the data, talk about what the projections look like, and how we've been responding to the community as a community. So, as the city of Louisville, we're several points ahead of the national average in terms of vaccination rates. So I just want to commend our vaccine distribution task force for the work that they've been doing. And if any of the media is looking for a good story to tell and kind of how we've comprehensively been approaching the virus throughout this pandemic, digging in and learning more about that vaccine distribution task force could be very illuminating. So thank you, Dr. Hartledge and Dr. McKinney, for being great leaders on the task force there.
okay. Thank you, Mayor. That was all of the COVID-related questions. I have a couple of non-COVID-related questions for you. The first one is from Lexi Ratterman. Why did you call out David James and Dorsey for contributing to the FOP voting down the contract? Also, will you offer even higher pay in the next proposal?
Yeah, well, first, the lieutenants obviously resoundingly passed the contract last night, so we appreciate that. And then on the officers and sergeants, remember what this consisted of was attempt to get much more competitive pay for our police officers. So 9% increase and then a 3% increase the second year. And then also inform the contract with some reforms that are designed to increase police community trust as well. So the team representing the city, that would be Metro government and LMPD, negotiated long and hard with the FOP to come up with a contract that then the officers and sergeants did not vote to approve yesterday. So a lot went into that. And so for some of the reasons that I discussed was, I think it's important that anybody that comments on the contract be informed about what's in the contract first. So it's amazing to me the number of people that actually weigh in with their opinion on a contract without even having read it. And I think that disinformation is a disservice, to both the people voting on the contract, but the community at large. Also, when the contract process is underway and the FOP is explaining the contract to their members, I think that should be the priority, and we should respect that process so that they can vote with the information that they have direct from those FOP representatives. And obviously that did not happen in this case with these two individuals, and I hope in the future the process will be respected further.
Okay, thank you. Rachel Joes has two similarly related questions. I think you just answered her second question, but her first question is, how do you see the city reaching an agreement on a contract with the FOP? And then the second question is, what do you feel led to the vote failing last night? And that's our last question.
Right. Well, in terms of, next steps, we're just going to have to wait and see right now. You have some people in the community and some on the council that did not think the reforms were enough. And then you got others that think the pay increases were not enough. So we'll have to sit down with the FOP after we kind of absorb this and talk about where we're going to go from here. So I'm not going to speculate on that. Obviously, we're committed to getting a contract with our officers and sergeants in place. They need to be competitively compensated, and that was what was represented in this past contract. And we need mechanisms to improve police and community trust. So we'll continue to work on all those with all the parties involved here so that we can get to a resolution that works best for everybody. And I've got to remind people too that we have to balance our budget. I would love to be able to pay all city employees more, police officers, solid waste employees, everybody. But first and foremost, we have to balance the budget, and there's not a money tree out there. And we have these kind of contracts too represent ongoing costs that will continue year after year after year, as opposed to, let's say, a capital project that's just a one-time expense. So there's a lot to consider in all of this. I rarely hear from Metro Council members or citizens that they want to increase taxes to pay for more services. So that's a consideration when you look at compensating departments at a higher rate or offering new services as well. So we'll communicate on all these issues as we attempt to get to a resolution on this contract. We have approximately 24 union contracts in the city. So in one way or another, they kind of all interrelated as well. So there's just a lot to take into consideration. But the bottom line is we want a police department that's competitively paid. And we also want to be seen around the country as a leader in reforms that lead to deeper police and community trust. So we'll keep working on it all.
That was our last question, Mayor. Thank you.
Okay. Well, thanks, Dr. McKinney, for joining us today. All the good work that you've been doing both on a local level and a national level as well. And Dr. Hartledge, to you and the entire public health team, and to the media for covering this pandemic. It's going to be with us for a while. Let's just continue to encourage people that have questions about the vaccine to get vaccinated. That's the number one way we can help everybody in our community and our country move forward. So thank you all, and we'll talk to you next week.